The director of the Pan American Health Organization said Wednesday, in the past week alone, there were 8 million new cases of COVID reported in the Americas, an increase of 32%.
Etienne warned that there could be outbreaks of other diseases because fewer children are getting routine vaccinations against things like measles and diphtheria due to the pressure on health clinics.
In the last week, more than 8 million new COVID-19 cases were reported in our region. This is the highest number of weekly cases since the pandemic started, and it is 32% higher than the previous week. The cases are spreading more actively and more quickly than ever before. It is clear that Omicron has become the predominant SARS-CoV-2 strain in our region at this moment. Over the last 2 years, millions of kids across the Americas have missed out on their routine medical visits, leaving them behind on their routine vaccinations. In fact, vaccination coverage has dipped so low that countries are at risk of losing 2 decades of immunization progress.
White House officials say that hopefully we will get to where COVID-19 is acceptable and could be considered endemic when it does not disrupt the capability to function in society in a relatively normal way.
In a White House COVID briefing, Dr. Anthony Fauci, the top White House medical advisor, says America wants to make it low enough so that it doesn't disrupt their capability to function in society in a relatively normal way.
Where we want to be is that sufficient control, and control we mean not eradication like we did with smallpox, that's unreasonable, not necessarily elimination like we've done with polio and with measles by mass vaccination campaigns, but a level of control that does not disrupt us in society, does not dominate our lives, does not prevent us to do the things that we generally do under normal existence. That would be a level of infection, but more importantly, concentrating on the severity of disease, hospitalizations and deaths that fall within the category of what we generally accept. We don't like it, but we accept it with other respiratory viruses. We want to make it low enough so that it doesn't disrupt our capability to function in society in a relatively normal way. We do that with other respiratory viruses. We know that we get RSV, particularly against vulnerable, the elderly and children. We get parainfluenza. We get influenza. These are important. We try our best to contain them, but they don't disrupt us with regard to challenging our hospital system, with regard to challenging the entire healthcare delivery system.